CCG has a demonstrable track record of delivering change, delivering improvements for the people of Corby, and being a thought leader across the county and across the region in terms of the next steps, whether it is through our collaborative care teams or whether it is through piloting other schemes. I think we showed that overall we have the staff and the will to actually deliver against the requirements taking the NHS into the future.
I was involved with the CCG at the embryonic stage when they were growing. Since then, they've established good relationships with themselves and with the public, and with focus. It's two-way conversations. They listen and they react, and I think they're up for the quality, and we feel that as a group PPG.
Well, I think the commissioning group should be applauded for their vision, and I think they have some very exciting plans for Corby, and I'm privileged to have been part of it at this fairly early stage really. So I think their vision is commendable in the first instance.
Our relationship with Corby has really grown, certainly over the last 12 months, and when I look back at our successes around transforming emergency care, we've moved from one of the worst performing hospitals in the country, actually second worst performing hospital in the country, to being consistently in the top 3, and this year, so far year to date, we've been in the top 3 since April. There's no way we could have achieved that without Corby Clinical Commissioning Group.
Recently I've been more involved with them, with discussions in trying to sell the point of quality of care closer to home, which CCG have brought in wholeheartedly. They also helped us in every possible way, trying to be part of the pathway, identifying the patients, and also supporting us to make sure that the pathway is right for the patient. When we brought up the idea of having step-up beds in the community, they were on it in no time, and also helped us to get the support from locally to make sure that we can get this provision going as soon as possible.
The System Resilience Group has been highly productive. It's gone from being very much a blame meeting many months ago to one that now is highly productive. We generate the ideas and hold each other to account for delivery, and I think everybody's clear about their roles and responsibility. Mitten chairs that group, I'd say very successfully actually. We have good senior representation around that table every week, and I think successes are very evident.
So I joined the CCG 12 months ago. Prior to that, I was a GP in Corby since 2006. I was a GP who, like all other GPs, had patients who were upset with services, things weren't happening as they were supposed to, and so I was encouraged to apply to be a GP board member. It was a scary transition, but I was encouraged, I was helped, and with the size of the CCG, everyone was there to support, so they can use me as the link between grassroots, general practice, and to make the changes to make not only their working environment better, the processes easier, but overall make patient care much better.
As a voluntary sector, we found the CCG very approachable from the time they were in shadow to the time they've gone through. We've been talking to them, they've been involved with our activities, been working with us. We're now working with, say, with GPs as a sector, working with the Borough Council, so we're trying to work in partnership for the benefit of the people of Corby.
Corby have been brilliant at including us as a charity. So they commission our service, which is Northamptonshire Carers, so we support unpaid family carers, and it's just the recognition from the CCG really that that's important, having them including us in a lot of the committees and places where they know that carers need a voice, and making sure that we're in those places to make carers heard really, which is gold for an organisation like us who have fought for that for so long. They definitely ought to be recognised for all of that work.
Corby CCG are making a difference in Corby and have been doing since it came together, is it now over a year?
I chose to come to Corby CCG, Corby Clinical Commissioning Group. I'm actually one of the newest members of the team. It's quite a dynamic team, very forward thinking and has a real can-do attitude, and that's what I really like. They aspire to be the best, and that's why it's so important to us to be put forward and shortlisted for the Health Service General Award.
Well, what I believe is because they've actually listened to what people have said to them. I think that's the important bit. And so much of what you've got in Corby is simply because you listen to what people said, and that's my great admiration, why I believe you should win this award.